Good afternoon, everyone. Happy National Healthcare Decisions Day. My name is Adam Del Molino, and I'm the Senior Director of Virtual Care and Clinical Affairs here at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Take a Simple Step, Become a Healthcare Planning Ambassador. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2026 annual sponsors and strategic partners for their support in underwriting today's webinar, which is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues like the completion of healthcare proxies. I'm pleased to introduce our speaker from Honoring Choices, Massachusetts today. Ellen M. DePaula, JD, is the president and CEO of Honoring Choices, Massachusetts. Ellen oversees all aspects of the organization and convenes the New England Healthy Living Collective and the Consumer Health Equity Advisory Group. She also chairs the Guardianship Serious Illness Advisory Group, co-sponsored by the Massachusetts Health and Hospital Association. Thank you so much for being here today as we are looking forward to this discussion. I will now hand it over to Ellen to get us started.
Thank you, Adam. Hi, everyone. I'm Ellen DePaolo from Honoring Choices, Massachusetts. I'm delighted to be with you on April 16th, National Healthcare Decisions Day. It's a busy day around the state, but this is a wonderful place to start for us here. We've been partners with MHA for 13 plus years, doing a lot of things together, and this is yet another piece that we hope we can support every member with. So I'm just going to start with the slide deck. And as Adam says, questions come up with this. You'll know a lot of this, but as questions come up, please put them in chat and we'll have some time at the end to really talk about it, because this is only as good as it works for you with your next patient. And that's what we try to do, is to make sure the tools really work for you. So our work here is just to support here the Simple Step campaign. And we do that. One of the ways we do that is to offer the Honoring Choices tools and our resources, and to also offer this ambassador program. And just a little reminder that for those of you who are listening today, this is for you, and it's also for anybody on your care team, whether it's a medical assistant or a physician or any role in between. Anybody can be an ambassador and start a simple conversation. So I want to start again with the Simple Step campaign. I think this is our third year now. And what I think about 3 years ago, we talked about, how do we all come together to do the same thing? So this was something that MHA initiated, a call for long-term healthcare planning. Those are the folks that you see their logos there have become cross-continuum partners in this. And so it's a great group that is working together. And the whole purpose is just to really say, you can do this simply. You can take a simple step. And that simple step is focused on choosing a healthcare agent and completing a healthcare proxy. That's what we want to focus on. And if you're not able to choose an agent, because we know a good 30 to 35% of the folks in this state are not able to do that for several reasons, we still want to include them in this discussion. And that's where the Honoring Choices Personal Directive or Living Will comes in. And we'll show you all of that today. There are Simple Step promotional materials that you can use, plus all of the Honoring Choices tools. And you can also, and a part of the way we support you is to say, become an ambassador. And I'll tell you a little bit about what an ambassador does. So that Simple Step campaign is on that link on the MHA website. And again, it's just those 3 steps. Can you choose a person you trust to be your designated agent? And just have a simple conversation about what's important to you. And then if you're ready to choose an agent, to complete a document that people, even though it's a legal document, people can do this themselves. They often need your help, though, with witnesses and just being able then to get it into the medical record. So it's a wonderful partnership. And then it also promotes a conversation with the care team about care that's right for you. That's the campaign. And what we do at Honoring Choices is, as partners, is to support that. So for those of you who may not have heard of Honoring Choices, I came to this work as a guardianship attorney and closed my practice and started this consumer nonprofit because it was became really obvious that people didn't really understand that they had a right to make a plan. They had a right to make decisions. They had a right to be informed about their care. And not only were we then saying, let's look at Massachusetts law, let's put up the documents on the website. But how do we support all the care providers to actually sit down and have conversations with folks to be able to make that plan and then to deliver that care based on what people wanted? So half of our work is supporting consumers, and the other half is, to my delight, supporting all of you. We look at this from promoting wellness, everyday wellness, 18 and above here, to managing chronic illness and living with serious illness. Everything we talk about today is on the Honoring Choices website, and all the tools are downloadable and they're free. So in addition to the website, we have this network of partners, which has grown in the last 13 years to many partners, hundreds of partners, thousands of providers using these tools. And even though everyone does something different, our point is to have equal access here to healthcare planning. So we have partners across the care continuum. You can see that on the graphic. These are all our partners. MHA has been a partner, as I said, so we support all of the members as well. So you need anything, just drop me an email and you'll see it at the end of these slides, and I'm happy to work with you. In addition to the community partners, we have this wonderful group now of statewide cross-continuum partner network. And the idea is, again, to keep standardizing reliable, accurate information for equal access to planning. So, of course, MHA, the Cross Continuum Partners in Simple Step, is right at the top of this network. But you'll also see the other folks who are coming into it. The Mass Department of Public Health, they actually partnered with MHA and Honoring Choices last year to promote a healthcare proxy campaign. And you're going to be seeing more about that in the coming weeks. And you can see all our other partners there. We're so happy to partner with AGE and the individual Council on Agings across the state who do tremendous work on consumer webinars and all of the ASAPs and the new Mass Pulse program, and you can read the rest. But this really helps us work together so you can feel pretty assured that the information that you're using here is really being standardized across the state. So what we did 13 years ago, I think a care manager came to us and said, do you have some kind of certificate for this process and these tools and this training? Because people around me have different information. So that's what we did with the ambassador program. We're really going to introduce the program to you, show you where all the tools are, and so you really can put them right at your fingertips. But what ambassadors do is have these simple conversations, and then if you want to use the other tools to go further, totally up to you. But it's just about engaging adults in early and routine conversations, helping them with that first step of making that plan. It's really incredible to us once people start to have only a simple conversation. They don't have to talk about chronic illness or serious illness, just simple. Let's take this first step. It really opens up a whole world and a whole way to think about planning. And then, of course, once you start to have that plan, it helps all the care providers to know how to connect people to care. So that's what ambassadors do. So when looking at our website, it's always good to go to up on the nav bar on the last section is the resources page, and everything is there. We have a program now really well embedded called Who's Your Agent? And the idea is that everybody has a right to make a plan. And one of the first steps in making that plan might be to choose an agent. That's how it goes. So it's a structured approach to healthcare planning. We came up with this healthcare planning process with our partners as a roadmap to say what are the important conversations from simple to serious illness. So we do a lot of the simple part with our tools and move to chronic illness. And we've also then worked with Ariadne Labs on their serious illness conversation guide, and they're in here too. So for the ambassador's point of view, it really is just those first two blocks, the green and the blue, just starting simple conversations. But the rest of the tools are there as you progress with your own people and patients, and you can take a look at that. We want them to make it very easy for you to tap into. So that's the roadmap, and inside of that process are three toolkits. The Getting Started and Next Steps toolkits have been there a long time now. Getting Started again is that simple conversation. It's really focused on the healthcare proxy and personal directive. Next Steps is everything else. It's how to build on those conversations through people's lifetime and add more documents to the plan. And our new toolkit, which I'll introduce you to today, is the Adult and Supportive Person Toolkit. we were finding that many people with a whole variety, a range of abilities and communication skills, or people who even had full capacity and full communication skills, just wanted to choose someone to do this work with them. We have a lot of older adult women and their daughters, for instance, where the adult who has the ability to make some decisions, maybe all decisions, chose her daughter as a supportive person to go through this process. So if you know people who choose to do it that way, we're getting some really good feedback on this toolkit, and we'll show it to you in a bit. So inside those three toolkits are the 5 Massachusetts planning documents. All this stuff is on the website. There are downloadable fact sheets on all of this and much more, but you can see how we break them down there. And what the ambassadors do is really to focus on that simple conversation. We want you to feel as informed as you need to be and feel really like it's a rote piece of your work that flows right in to start a simple conversation. And the Getting Started Toolkit helps you do that. This is a toolkit you can actually give to consumers. It's made for them to fill out. So you can use this toolkit or just use the individual documents that are in the toolkit. But it's a 1, 2, 3. It's a who's your agent? Can you choose an agent? And if you can, let's do a healthcare proxy. And then what matters to me? How do we write down what's important to us and give some instructions for care? And then the big thing, as Adam mentioned at the beginning, is making sure this gets into the medical record. That is still a big block. It's interesting. People will tell me how proud they are that they did their documents, and I'll say, terrific. But did you give them to your care providers? And that's where you can be really helpful in bridging that, making sure it gets into the medical record. So just in terms of the way we work here, everything is based on Massachusetts law. And the law is really specific about this, is that the word agent, the person you choose, is actually called your agent, and the document is the proxy. And that's why you'll see the way these tools um, flow out. And we have found, and the ambassadors have found, that just talking about a person instead of a document, talking about who's your agent, have you talked to your agent, who's that person you trust, have you told them what you wanted for care? You can't pick an agent? That's okay. Let's do something else. And that conversation just flows much more easily. So in the Getting Started Toolkit, it's a 1, 2, 3, right? This is where you choose the person to be your healthcare agent. And there's a lot of information on that. Anybody can be a healthcare agent, 18 and above. It just can't be a person who might be a conflict of a physician or someone who takes care of you unless that person is related to you. And this is where usually within 2 minutes of this conversation, you usually find out if people have someone to choose or not. And the ambassadors do such great work in being very inclusive of whoever they're talking to and saying, you know what, you can't choose an agent? That's okay. We're going to start with step 2, and we'll show you how that works. But if people can choose an agent, it is such a protective document in terms of people's rights. And we have found certainly too how much it's helpful to our care professionals just to have a person to talk to, an advocate, if you can't talk to the patient. In this state, it's very important. The law says we need to appoint, we need to write that person's name down in a healthcare proxy document. Not true in the New England states around us, but true here. And the simple explanation we give of why to do this is that the healthcare proxy is the advocate, right? That's the person who's going to make care decisions. Even, someone who can step in, even just for a little while you get better, with that legal power to do that. Most of our consumers still are finding out, they're still surprised to learn that the spouse or a family member doesn't automatically have legal power to make those care decisions unless they're appointed in that healthcare proxy. So even though we move forward sometimes without ever asking about the proxy, I'm sure you know the situations where family is together and they've made different decisions about care and no one has been appointed in that agent, and it sets up a really difficult process. So that's usually when we tell folks who are saying, oh, my wife will do it for me or my daughter will do it. It's like, let me tell you about this law. And that usually is motivational for people to do the proxy. So this is the conversation. It's a 2 to 3 minute conversation. That's what we look at it here as a simple conversation just to get us started. And we invite you to use this if you want or anything that you're comfortable with. But in talking to people to start a conversation, if you get sick and you can't make healthcare decisions yourself, even for a short while you get better, who would you choose as your agent, a person you trust? And usually that's all it takes. And it starts a very easy conversation. And it can wind down into three different places. People will say, oh, yeah, I have it. I have a person I like to choose, and I've talked to them a little bit. And then you can offer to do a healthcare proxy. As you'll see, it's in 17 languages here. If they already have a proxy, you're in a unique position to check. We still are seeing the research nationally that a good amount of the documents may not be valid. And that's true in Massachusetts too. So it's great to check if it's signed, if it's dated, if there are two witnesses on that form. It's better to do it now when someone has capacity when they don't. And if they're not able to choose, that's another conversation about that's okay. We're going to get you started with a personal directive. That's the conversation. And it's pretty simple. It really works out that way too. Um, so you can use your own healthcare proxies, of course, anything you choose, but the Honoring Choices proxy is there for you. It's in 17 languages. It's been amazing to our partners actually tell us what they need in their communities. So if there's something here you don't see, just drop me an email and tell me what would be best for your community. But it's a one-page document. As you see, it's pretty simple. What goes with it that's been really fun is this I have a healthcare proxy wallet card. It doesn't replace the proxy, right? We still need a legal document. But this is an information card that people can use to say, I have a proxy in an emergency, please call my agent. And you fill in that little piece of the card. So it's simple. It's in their toolkit, but you just download that rectangle on a regular piece of paper, cut it out, fold it up, and fill in the names. We have heard time and time again how this has been such a helpful tool. A gentleman who, fell in Market Basket and hit his head. EMS was called. They come. They're not sure who he is. He's not speaking very well. They look in his wallet. There's the card. It had his daughter's name on it as his healthcare agent, and they were able to call her right away and say, your dad's okay. We're going to X hospital, and she met them there. It's a wonderful connection. The interesting thing about this card is that it's been motivational for people to do their proxy. So you can use it for any healthcare proxy you want. So what if you're talking to someone and they're not able to choose an agent? And one of the things our ambassadors have been just wonderful at is to just stop and be incredibly inclusive here and say, you know what? No agent, that's okay. A lot of people can't do that. So let's start with this personal directive document. Although it's not the same, it really helps us do the most important thing, which is to know your choices and preferences for care in a medical emergency. I'll show you what that is. But these are the three reasons usually we're hearing from the ambassadors about people who would prefer or want to start with a personal directive. Certainly, if the adult says, I'd love to do a healthcare proxy, but I have no one to appoint, we hear that a lot. Adults with limits to decision making where they really can't do a proxy, they can start with a personal directive. And we're hearing a good amount from families who would just prefer to start with a conversation as opposed to appointing an agent. And that conversation can be started with that personal directive. So that brings us to step 2 in that getting started toolkit. Step 1 is focused on the proxy. Step 2 is focused on what matters to me. And this is a personal document. You fill it out to talk about the values, your beliefs, your concerns, the care you want, the care you don't want. And it becomes a guide. If you're able to choose an agent, this is instructions for your agent to say, here's what I want you to do in an emergency. So you can attach it right to that healthcare proxy. And if you don't have an agent, this is the place to start. So we're talking to folks who are important to us just to talk about what's important to the person, to perhaps give some instructions for care. We find that people usually have an idea of the care they want and the care they're worried about. And they can write it down in this personal directive. And this is what it looks like. It's in your toolkit right now. This is in the Getting Started toolkit. This is a personal document in Massachusetts. It's not a legal document. And what that means is that even though these are your wishes, they don't legally bind professionals, care professionals to follow them as they do in other states. However, in this state, if a care provider knows someone's preferences and what they want for care, they do their best to follow through with that. So in this document, people do this on their own. The first page is about writing down those personal preferences, what's important to them, what they want to do in an emergency, if they have any personal values, religious beliefs, spiritual beliefs they want people to pay attention to. Question four usually gets a good discussion going about here's what worries me most about getting ill. And then we can go from there. So people can do this on their own. Number two at the bottom has been very helpful, especially when people don't have healthcare agents. They usually have other people around, someone at the Council on Aging, maybe a faith-based relationship, maybe a neighbor, and they can put that name in there to say, here's a person I want to know, want to contact if I get sick. The second page of this is really just writing down medical care choices. We're going to redesign this document in about over the summer because A has gotten so big. People really just want to write down what they know about their own care, their med list, people who they want to be treated by. It's become very important too for people with chronic illnesses, complex illnesses, behavioral health issues to really be able to say what their choices are. And then what's included on here is this an idea of life-sustaining treatments, or if we get to an emergency situation where the heartbeat and breathing stop, what do you want people to know about your thoughts around this? This is not a MOLS form. This does not replace the MOLS form. This is just information about what people would want. This came into this document because some of the senior elder adults were saying they wanted to write this down somewhere. They weren't eligible to do a MOLS form yet, but they wanted it known. So that's what the personal directive is. You can write on the back, you can write anything you want. You sign it, you date it. No witnesses are needed here, none. But it is a great document to go along with the healthcare proxy, or if you don't have a healthcare proxy, feel free to use it. And then the third piece in the Getting Started Toolkit is just about that bridge Adam talked about at first. It's like, how do we get these documents into the medical record? And then how do we start conversations? And that's what we find the documents do. We were very surprised, 10 years ago to learn that when people did any document, a healthcare proxy or personal directive, it just engendered a conversation with their care professional, even just in getting it into the medical record. And then, of course, thinking about goals of care. So that's the Getting Started Toolkit. There's two more pieces, one more piece in it. Many years ago, people came to us and said, what are we supposed to talk about when we're talking to our providers in the short time we have with them? So we came up with a conversation guide, 5 things to talk about with your care providers. The blue lettering on the left is really about the rights people have. Everyone has a really strong right to information, to make choices, a right to talk about their goals and the care they want and don't want, to make a plan, use these documents. And the purpose, of course, is so that we know people's choices and can honor them. So this is a conversation guide you can give to consumers. They don't ask all the questions. They kind of pick and choose. If you download it, there are some lines on the bottom they can write in their own questions. And for you, here's the exact same guide, just from the care provider's point of view to start conversation. So you should feel free to add this to your work, maybe to the scope of your role. Use it as you like. But that's all in the Getting Started Toolkit to start a simple conversation as an ambassador. Now, we just want to tell you about this new toolkit. This has been really an interesting journey, the Adult and Supportive Person Care Planning Toolkit. In Massachusetts, adults make decisions, whether they can make some or all, whether they can make them with help or without help. Those are their decisions, and we honor those. So folks can pick a supportive person, anyone they want, a family member, a care provider who can help them on this journey. They can help them make a plan and help them get some care. So this is meant for adults with a range of abilities, whether they have a full ability to make decisions or whether they have some decisions or communication skills can be really vary. We developed this toolkit with Minuteman ARC for adults with intellectual and developmental disabilities and with the Alzheimer's Association with people with dementia. So inside the kit, and again, if you know someone who wants to do this with someone they trust, who may or may not be their agent, it doesn't have to be. The first step in this is a 3-step guide, and it really just sets out a checklist for the supportive person and the adult to say, how can you really help me? The adult would make those choices. What can the supportive person do to help? And these are the top 3 ways they can help to make sure that person is getting information in a way that person can understand to be able to make informed choices. and then to show or write down whatever their care choices are or their preferences are in a personal care plan, and then to take that next step and to talk with care team members to get them the care they need. So the three-step guide is in here, the personal care plan, which is its own separate, it's like a personal directive, where people are going to write down or show their care preferences. The difference here is you can use text or you can make a digital copy and cut and paste in pictures, which has been a really interesting thing for people to do. And then you can make that plan either you can just download the paper document and have it, or you can make that digital copy. Let me show you what one mom and her son did. So the son was in his, I think in his mid-30s. His mom was his supportive person. They sat down and they did part of the toolkit together. So this was part of that personal plan. There are 6 questions. This was question 3 that says, here's the kind of medical care and services that I want to receive. And you can imagine question 4 says, here's what I don't want to receive. But this is an opportunity for this person to really pick and show what he wanted through pictures. Text was not something that he could do, and his mom, as a supportive person, really wanted to support what he wanted to write. So you can see we did a thumbs up and thumbs down on the way to take medications, and these are the preferences, right? That family comes in. This particular person wanted to be able to have extra time to ask questions himself. So that's in the plan. We may have needed an interpreter there. One of the things his preferences was not to put on a Johnny. If we could just stay in his clothes, that was a preference, and to be able to use his headphones in loud spaces. And so this is what he chose as the things that were important in receiving care, going to a doctor's visit, a hospital visit. It becomes a very powerful tool for folks. So that's what's in the toolkit. And again, people can use text or people can use pictures. Okay, so that's that new toolkit. The Next Steps toolkit has been around a long time. It functions a little bit differently. So let's say you've started a simple conversation with someone. We've talked about the healthcare proxy and personal directive, but you're talking to someone who's trying to manage chronic illness or even live well with serious illness. So we want you to know these tools are there for you to use as you help patients and to update their plans as well. Hopefully they'll just stay in the background for you. But the conversation guides are there. So we kept developing the handy conversation guides, a set for care providers and a set for consumers. And you see it starts with that simple conversation that's in the Getting Started toolkit. And then the questions evolve around managing chronic illness. The questions change again around serious illness. And then there is a guide for palliative care. What is that? When can I have it? What's it like? So those guides are there for you and easily downloadable, and they're also there for consumers or patients you work with. We have serious illness conversation tools on our website. As you said, in addition to our tools, we've been working for a long time with Ariadne Labs as a partner, and their tools and our tools work seamlessly together. So that should help in terms of your conversations. And if you haven't seen the What Matters to Me workbook, it's a great workbook. It's for adults and families to prepare for conversations. They've serious illness conversations. They've told us many times that they want to take some time to be prepared before they sit down with their providers. So that's all on our website in the Next Steps toolkit. And this is where you can add documents. The durable power of attorney, the MOLS form right now, medical orders for life-sustaining treatment, and the comfort care do not resuscitate order. So these are not documents on our website. These are fact sheets and sample forms to be able to offer to folks so they can just get more informed about what these documents are and what they do and when to talk about them. Let me just go to the durable power of attorney. So here on the right side, you will see the durable power of attorney fact sheet that we have. What is this document? That it's a legal document in Massachusetts. And in this one is where you appoint a trusted person to manage and protect your financial matters, your money, your property, your business affairs, if you're not able to do that for yourself. So you can do it if you're just, we had a gentleman who was, actually, he was an accountant. So most of his life he worked with numbers, but he realized he was getting to a point where he wasn't as sharp as he was, and he wanted some help with doing his paying bills and doing some other things. So he got a durable power of attorney. You don't have to be incapacitated. You could just want somebody to appoint someone to help you. So that's the fact sheet. And what's become really important here in working with MHA and Adam and the throughput surveys, we've really learned that this can be a really hard transition here from hospital to post-acute care when if someone has gone into the hospital and has now lost their ability to really make those financial decisions or to write contracts for care, and they don't have a durable power of attorney, and we look at alternatives to conservatorship, and if that doesn't work, then the hospital is in a situation of having to start a conservatorship, a legal process, and we know this can take months and be expensive and be hard to do, and that's when patients are really having to stay where they are until that process is completed. It's very difficult for you all. It's very difficult on the family. So if you know folks who are at that bridge of thinking they may need a durable power of attorney sooner than later, if you can offer this fact sheet or start a conversation, it really may help them avoid a conservatorship. You know about medical orders for life-sustaining treatment, no doubt. This is the document for people with serious illness or advanced frailty, where the um, we have three signers of the form, right? The medical doctor or the DO, the nurse practitioner, the um, PA can sign this form. Anybody can talk about it. Anybody can offer information on what MOLST is. But when it comes to this form, the clinician will review someone's current prognosis. This isn't so much an advanced care planning document as a current planning document. Someone has a serious illness or advanced frailty, and we want to talk about that prognosis, the goals, the treatment choices. The patients, once they know the benefits of these, what these treatments are, what the benefits are, what the risks are, it's the patient who makes the choice on CPR and A and B for ventilation and C to transfer to a hospital. That's our current form. And then it's the clinician who fills it out and makes it a medical order. The patient signs or the healthcare agent can sign. The guardian cannot sign this form unless they go and get court authority to be able to sign it. And that's been well established especially in the last few years. But it gets signed, and then this form is made to be updated. It's made to be reassessed as people's healthcare needs change and as their preferences change. So that's the most form, and we are going to talk a little bit about what's coming for the change for this in just a minute. Oh, here it is. So as I'm sure most of you know by now, MHA is very involved in this. We're so happy that that's all come together to work with the state on developing a new Pulse program. So the state is really upgrading from the MOLST form to the Pulse form, to a Pulse program. Pulse stands for Portable Orders for Life-Sustaining Treatment. So what Massachusetts did, let's see, 5 or 7 years ago, maybe 5 years ago, I was part of this mission to be able to join National Pulse and be on that board and really listen to, be part of those committees to listen to 47 other states and how they work in serious illness and how they work with these forms. It's a wonderful website. You can always go look at it to see what's happening there. We have Massachusetts people on those committees and on those boards as well. And a few years ago, the state made a decision to go from our MOLST form to the Pulse transition, and it's being led by OEHHS and by AGE. And the major changes is going to be we're going to move to a new form. So MOLST is going to stay in place. It'll still be valid for a while, as also with the DNR, but we're going to transition to this National Pulse form. You can take a look at the national form on the Pulse website. What Massachusetts is going to do is adapt that form a little bit to Massachusetts law. But the big change is there's going to be a 24/7 e-registry, and folks are going to complete the Pulse forms online. That's going to be the preference, to complete it online. That's going to be what everyone's going to be doing, and then it's going to go into this registry so that it's very easy to retrieve. The wonderful thing I'm excited about is with this new form, there's going to be a new way to talk about serious illness and Pulse conversations. And there are going to be new educational modules that are actually being prepared by R&D Labs and serious illness conversations. So again, all these tools will work together. But you'll all be able to access that. There's going to be a consumer education piece and a call center. You'll actually be able to call someone if you need some help, and so much more. Wonderful group of people putting this together. They're very open to your comments. They're very open to your ideas. They just announced a go live, so this is actually going to happen in April of 2027. Plenty of time for us to think about it. And I know MHA is working very hard on it, and you'll hear a lot from them. But Priscilla Ross, who runs Mass Pulse, as we do our work in our spring celebration here and talking to everyone, wanted me to just put this out here again. If you want to know more about it, that's the website at mass.gov/masspulse. You can sign up for updates. You can come join a meeting and come hear about it firsthand. So that's the exciting thing coming. For those of you who are working in guardianship, conservatorship, and alternatives, we invite you to take a look at the Honoring Choices webpage on this. We've been working together with the Probate and Family Court to make sure our information on this really works well together. There's a section on what guardianship is, what conservatorship is. We list what the alternatives are and the supports are, and we're going to be enlarging that section in the next couple of months, and how and when to start a legal process. This is even though a lot of this information is written down in the court procedures, we want to be able to just put it at your fingertips. So feel free to go take a look at it. And that just brings us around to the MHA Simple Step campaign again. So very simply now, just starting a simple conversation to choose an agent and to complete a healthcare proxy. And if people can't do that, to talk about the personal directive. That's the campaign. You can go to patient care link and find out more about it as you go. One of the things that we developed together last year, I think, between Simple Step and Honoring Choices was this consumer handout. And it's been really working very well. It really simply says, who's your healthcare agent? And starts that idea that you get to choose at 18 years old. And here are the 3 steps. You choose someone, you print a healthcare proxy, and you can fill it out. And the wallet card is also here. And then make sure your providers have it. And there's a QR code which gets you to the Quick Start page. And that's our Quick Start page. And so if I leave you with anything easy today, this page, if you know someone who wants to do a healthcare proxy, this works really well with the Simple Step campaign. It's right on this page is how to, it's quick and simple to do that proxy. You can, there's some videos on how to choose an agent in a few languages. There are the healthcare proxies right there you can find in many languages, and the wallet card, and then a reminder to really share this with all of you. Give a copy to the agent, give a copy to the clinician, and if you're not able to do this, there's information on the personal directive. So right there is the quickest place to go to work with the Simple Step campaign. Okay, and then just finally, everything we talked about today is on our resources page. If you just open up the website, it is the last section on the navigation bar, and the process is there, the toolkits are there, how to personalize all of this is there as well. And feel free to use it. You are members, everything is free and downloadable. Please take as much as you want. And then let us know what you need. That's what we do with our partners. And if there's something that's not working for you or you want to develop a tool, we're happy to do that with you. So Adam, I'm going to end by congratulating everyone and saying you are now healthcare planning ambassadors. It's voluntary. It's also personal. And we're going to send you a certificate so that you can, if anyone says to you, some misinformation about a healthcare proxy, you can show them, no, not, I know what's best. So any suggestions or questions you have, I'm so happy to answer them and support you.
Awesome. Thank you so much, Helen. We love this presentation and we love being able to do this actually on National Healthcare Decisions Day. So just really want to just express our appreciation for all of this work that you do with us and with our members. A number of questions have come in the chat, and I wanted to run a few of them by you.
Sure.
The first one says, how does California compare to Massachusetts in this legal space?
Wow, that's an interesting question. So, generally speaking, and in my opinion, they can be pretty much, ahead of us. but every state has a different law and a different way to do this. So it filters down differently. I think again, I got to give you my personal opinion that our healthcare proxy law here is very strong, and I continue to like it, even though it gives everyone a bit of a headache if there's no agent, because I'm choosing who I want, and that's the person I'm appointing. So I think in that way we're really strong. They're a little bit ahead of us in terms of MOLST and POLST and serious illness care, but the great thing is we can learn from them now. They've got tools that we'll be able to use.
All right, and the next question coming in asked specifically about the proxy documents. It says, if these documents exist within my EHR, how does interoperability work if I am outside of Massachusetts or in a different state?
Yeah, it's a tough question. So there's nothing that we have right now that makes it easy to do that interoperative ability. The way that we talk about this with consumers is they need to carry their proxy with them or keep a copy on their phone so that when they get to a different state, if it's needed, there it is. Um, I can tell you that in the 6 New England states, we've been working with them very closely to try to clean up those pathways. And typically, if you are on vacation in New Hampshire and you need your proxy form or other forms, they should accept it without a problem because our laws are similar. If you're in California or Florida, there may be some pushback. And they certainly can they look up the form? It's we don't know. It doesn't always translate to being able to tap into the other EMRs in the state. Right now, that's not a possibility. Did I answer that question sufficiently, though?
I think so. I
Okay.
think you did. So then the next question comes in. It's kind of also a similar question. We get a lot of questions about EMRs and EHRs. Did you say, and the person wanted to just clarify that you said that the healthcare proxy form should be a part of your medical records?
Yeah, well, you have to put it into your medical record, right? Is that so? Tell me now, again, I'm not that versed in this language, Adam, so help me out. But so I was at my primary care the other day, and they actually asked me if I had a healthcare proxy after, 20 years of being there. But I said, great, okay, good. And I said, I don't, how do I get it into your record? And they told me how to do it. Put it in the portal, and they would switch it over. Not everybody can do that. So physically handing people a copy, if a patient walks in and gives you a copy, the law says it goes in the medical record. Now, is it more complicated than that in terms of how it goes in? Probably. Um, but one of the problems is we don't have one system, right? And I asked my primary care the other day, I said, so who can see this document? Because I wanted to know who actually could access it. And they had a list of hospitals and they had a list of some other things, and that was it. So if I'm outside of that system, people are not going to be able to reach into it.
Yeah, and I think the most important thing here is after you complete and sign a healthcare proxy, PDF it and upload it to the system and give it to your clinician or email it or get it to your clinician in any way that possible so that they can upload it into the system because most systems now will have a location for it in the patient's medical record. And I know my primary care office can do that, and I think most primary care offices can do that now. So
Mhm.
it's at least going to be shared within the system that you're generally working within. And I would hold on to a copy of your records as well in case you switch doctors or to move to a different location.
Yeah, and always, and if I may add to that, that we recommend that people keep a copy. A lot of times people will say, well, my hospital has it or my doctor has it, but they don't have a copy of their proxy. So if you can remind them to get one, make sure it's in the system. That helps to know if it's there.
So a couple other questions that folks put in the chat, Ellen.
Mhm.
What's a good way to start a simple step campaign at your hospital?
And I'm going to throw that back to you, Adam. All our tools are ready to go, but simple step, you tell me.
I think the best and the easiest way to start a step campaign at a hospital is to work in conjunction with Ellen and her team and reach out to Ellen, and Ellen can help to walk you through the creation of a program. I think it's also good to bring in community partners, people like your local aging services access point, your elder services agencies, and others that you might be typically working with for a lot of the care that's provided in your community. I know we have some folks that are actually doing events today on National Healthcare Decisions Day, working in conjunction with those same agencies to really put together a program to get as many people as possible in their communities to come make sure they have complete signed healthcare proxies that are notarized, and then they upload those into the system. So I think that's a really important way of kind of building and starting a campaign at your own hospital facility, and a simple way of doing it as well. Bringing in food and drink and any way to kind of get people to kind of think about completing a healthcare proxy and getting them in a session to do that, I think is a really great opportunity.
Yeah, and let me just piggyback on that. So with our on our website right now, we're just in the middle of the 13th annual Healthcare Decisions Spring Celebration, and you will see 75 partner events, and they do things like donuts and decisions, and pizza and proxy, and they bring in. And what I noticed this year is it's not just the Council on Aging is doing it, but they talk to their hospital, they talk to the local care units, and they all came together, and that they're doing a lot of that this year. So that's wonderful. We know who those folks are in your community here, and we'd be happy to, as Adam says, give me a call and we'll put something together for you that really is tailored to the people in your community.
Yeah. Another follow-up question came into the chat as well, Ellen.
Mhm.
Going back to our conversation about the healthcare proxy and the medical record. The question says, so then if you do not have a healthcare proxy, but you create a personal directive, do
Mhm.
you do the same thing? Should you do the same thing and upload it to your medical records?
Yeah, that's a great question. So since that's a personal document, that's really up to the person is thinking, do I want to put this in my medical record? And what we find is for adults who may be solo agers or who don't have an agent or don't have family, they actually prefer to have a conversation with their primary care person. And then it's those folks who are putting it in their medical record. So there's a transfer of that. Some people prefer not to do it because they figure that personal directive is going to change over time. But again, it's like any other document in your medical record. You want to keep updating it as you go. So it's person choice, and then we've had no pushback from primary cares, from hospitals, from all of our partners about putting that personal directive in the record because it only helps.
Exactly. Um, Another question coming into the chat is when you're thinking about what the essential tools and documents are to include in a simple step campaign, what are the key pieces that you like to give out to folks to make sure that they have everything that they need?
Yeah, so that it's pretty consistent now. So when we start simple step, we're starting with that simple conversation. We like to give you the healthcare proxy and access to 17 languages, that personal directive for folks who can't do the proxy. The wallet card will come with all of this, and the getting started toolkit will come with it. And then what we are recommending lately is that you have access to that durable power of attorney, a fact sheet, either ours or your fact sheet, so that we can really think ahead about preventing conservatorship, if possible.
And then lastly, the question that came in was, can we post the Honoring Choices healthcare proxy and tools on our websites or include it in admission packets?
You certainly can. So the way we started this 13 years ago is these are free downloadable documents and we can all use them. It helps me to know if you're going to do that. I'm always get a kick sometimes. I'll go on the internet and find out who's using the tools. It's better if you tell me you're going to use them, and we'll help you tailor what you need to your website. Everyone does it a little differently. Some people just put the Honoring Choices link up there. Some people actually put the documents up there. And I prefer you put some of the documents up. So it's really easy for people to go to your website and to download those tools. Just send me an email.
Awesome. All right. Well, I've come to the end of the questions that have come in through the chat. I just want to give folks one additional opportunity in case they have any other suggestions or thoughts or questions for Ellen. I'll give it like maybe a minute, a second here. All right. So, seeing no further questions, I just want to take this opportunity once again, really to thank Ellen for kind of everything that she's done for us here at MHA for the event and really just kind of being such a great partner for all of us. Also want to kind of just bring to our attention for our folks upcoming events here at MHA in particular. Um, Two that I would note is on April 29th, MHA is going to be hosting an AI in healthcare event at the MCLE Conference Center in Boston on AI with regards to equitable care navigation. That's an in-person event in conjunction with the National Association of Health Services Executives, Greater Boston chapter. And then coming up on May 19th, we will also be having our Emerging Leaders Summit, also at the MCLE Conference Center in Boston. And don't forget as well, if you're interested, we will also be having our MHA Post-Acute Care Summit coming up on June 11th. We'll be having more of a conversation with regards to the Most of the Pulse program there, and we'll have Priscilla Ross, who Ellen mentioned previously, there to talk about that transition from most to post here in Massachusetts and the implications for our member hospitals and for our patients. Thank you all so much for joining us today. Really appreciate it and have a great day. Talk to you soon.
Thanks, Adam.
Thanks, Ellen.